in challenge offsets which they are supposed to provide. So today on my left here, we have Miss Chiwera from Women Coalition of Zimbabwe. She chairs the health committee within the Women Coalition of Zimbabwe. And also we have on the far right, we also have Ms. Loreni Mpasirisani, the director of the Combined Arrest Association. We are also joined by Mr. Piki, who's also representing the National Association for the Disabilities, who is also be part of this process. So I will not take much time. I will hand over this time to Ms. Lorraine Mpasirisani from Combined Arrest Association, and then we will also hear from Ms. Chiwera from Women Coalition of Zimbabwe. Thank you.
Good morning, everyone. As Combined Harare Residents Association, we are shocked by the Harare City Council's challenge of the High Court order, which was meant to compel the local authority to open council clinics and also to honor its constitutional mandate to provide health services to residents. The appeal by the council to challenge the order clearly shows that the Harare City Council is not willing to reopen the clinics and improve health delivery in the city. The city has been captured by self-serving individuals masquerading as public officials, both elected and non-elected. We reiterate that the right to health enshrined in Section 76 of the Constitution of Zimbabwe is inseparably connected to the right to life within the Constitution and other international legal instruments. We are aware of the machinations behind the court challenge, which are meant to the High Court order, as well as buy time in line with the order which was granted in favor of residents. CRA is also concerned and disappointed with the silence of the central government, in particular the Ministry of Health, over the closure of the clinics when it has an oversight role over the Council Health Department. The attainment of equitable coverage and enhanced quality of service delivery as provided for in the Transitional Stabilization Plan will not be achieved when we have a local authority that unilaterally closes clinics for unjustified reasons. The burden of the closure of clinics is unbearable, especially towards pregnant women. We have a role in giving life and taking care of the sick in the homes. We have lost lives of women and children due to the paralysis within the city of Harare's health delivery system. Section 76, subsection 3 of the Constitution is very clear that no person may be refused emergency medical treatment in any healthcare institution. Yet just yesterday, we received reports from some of our ward committees that a pregnant woman in Highfields had a miscarriage after being turned away at Highfields Polyclinic. And the reasons that were given are that one of the nurses is alleged to have said that their salaries are not sufficient to attend to any sick patients who visit the clinic. So we would like to remind the Harare City Council as CRA that it is a public institution established through Section 274 and 276 of the Constitution. We therefore recommend the following. The Harare City Council must consider withdrawal of the court challenge on the High Court order to reopen the clinics. The Harare City Council must find progressive ways of resolving labor disputes within its health personnel so that these disputes do not fall to negative delivery. The Ministry of and provide funding for the City of Harare's health department, and as well as strengthen its capacity on its mandate. Thank you. Maybe I'll leave this to Wera, and then after that we may ask questions.
Thank you very much. Good morning, ladies and gentlemen. We, as Women's Coalition in Zimbabwe, call for the prioritization of the healthcare sector in the country. The Women's Coalition of Zimbabwe, being a non-partisan national network of women's rights organizations and activists striving for the rights of women and girls, stands in solidarity today with the rest of the nation in making a call against the current state of our healthcare system. Our citizens, particularly women and girls, have the right to enjoy and benefit from a good, adequate, and functional healthcare system as envisioned by the Section 76 of the Constitution. Women and girls have specific health needs, and health systems in our country are failing them. Yet the World Health Organization has made it clear, time after time, that women's health is an urgent priority. The right to health is sacrosanct with that to life and dignity. Yet our women and girls have long been vulnerable to human rights abuses and suffer poor health outcomes as a result. The closure of these 42 clinics in the city of Harare being one of them. The deprioritization of our healthcare system from the national budget and the political agenda has had negative consequences on our women and girls. We have to consequently travel long distances for general health care, maternal health care, and sexual and reproductive health right services. It has become a daily synopsis for our women and girls who have to wait in long queues to access treatment and who have to bear the brunt of collapsing healthcare sector with their own lives. We continue to mourn our fallen heroes and future leaders who died in the hands of this healthcare system due to the neglect, the ongoing industrial action by nurses and doctors, and inadequate medical resources to sustain operations. We also continue to mourn in this day and age the mothers and babies whose special life event turned tragic as they lost their lives during labor and during delivery. Our healthcare system has turned into a death trap, and this spares us with no hope of a better future for ourselves, and even in these trying times as we battle the COVID-19 virus. How long will we watch our citizens dying from treatable illnesses? What will it take for our government to heed the call that we are killing our own citizens, women and children? We call upon our government to, number one, prioritize negotiating and bringing to amicable closure to the ongoing industrial action, thus ensuring that we have healthcare workers capacitated and equipped with necessary, adequate, and quality personal protective clothing. Number two, to prioritize our healthcare system in the national budget by allocating at least 15% of our annual budgets to the health sector and as envisaged by the Abuja Declaration, so as to improve our healthcare system to the benefit of our women and girls and the citizens at large. Thank you.
I'll get my colleague from SNASCO to also give their comments on the closure of
Thank you very much. The National Association of Societies for the Care of Healthcare, we represent the sector which is downtrodden. Persons with disabilities, as the World Health Organization states, in every population there's 20% persons with disabilities. And now we are looking at the primary healthcare centers being closed, and they are the cheapest. They are the only affordable places where these people can get help. And now we are looking at the city council closing such institutions for reasons that are very, very unknown. if you look at them, they are driving luxury vehicles. Their vehicles are fueled. So where are their priorities? You consider someone who is in a wheelchair. Suppose it's a pregnant woman. She uses a wheelchair. She needs an assistant to push her to the clinic. Now this clinic has been closed and she's directed, suppose she stays in Budiro and she's been directed to go to Kwata. What it means is now she needs to find a combi, public transport. She must pay for herself, for her assistant, as well as the wheelchair itself, for space to get to Kwata. And if you look at that, it means it's very expensive for the disabled community to even try to be redirected to get services that are supposed to be at their doorsteps. So we are saying as NASCO, we cannot have this. We have heard that the World Health Organization has granted COVID-19 funds. Where are they? Why can't they be prioritized to be disbursed at such centers? Why don't they have nurses, senior nurses that can at least attend, or a skeleton staff, so that some cases can be attended to? So that's what we are saying, that we need to consider women with disabilities, because they have a double-edged sword: discrimination against being a woman, discrimination against being a woman with a disability. Then also, disability itself is very expensive, as you can see. Even if she's a woman with a visual impairment, it means she needs also to pay for her assistant to guide her to the next clinic which has been redirected. And when you get to that clinic, you still don't get a service, from what my previous speaker said. So what are we doing? It means we are simply slowly killing persons with disabilities. I thank you.
So colleagues, if you have any questions, maybe you can throw to any one of us.
My name is Elan Tali from 263 Chat. From your statement, you said you are aware of the machinations behind the court challenge. What would be the rationale behind the court challenge by the city of Harare? Then secondly, should the city of Harare consider not to withdraw the court challenge as you recommended? What is the way forward?
Yeah. So in terms of the machinations that we were talking about, if you look at the court appeal that they made and the reasons that they put forward in the court appeal, it clearly shows that the city of Harare is not willing to open those clinics. They are not prioritizing the health of residents, and they also want to buy time. Because in their court appeal, they mentioned that the court erred in giving the order because the residents took time to approach the courts. So that alone is not a justifiable reason, especially when we are talking about a fundamental right like the right to health. So we are aware that the Harare City Council is not willing to open the clinics, and also they are not willing to address the labor disputes that are within their health personnel. They are also not willing to heed to the call of residents to open those clinics. So they are trying to just buy or to simply refuse to open those clinics, because the reasons that are put in the court appeal, they are just not they are not justifiable. So they were really not focusing on any issues to say they are incapacitated or anything, but they were trying to look at technicalities that are still not justifiable. That is the reason why we mentioned that. And also, in the event that the Harare City Council then refuses to withdraw its appeal, we will still approach, we will still challenge. We are actually going to challenge that appeal as well as citizens. and we have evidence of citizens who have suffered, some have lost their lives. There is another woman who had to give birth in a well because she was turned away from delivering at a polyclinic. And those things are not, they are not justifiable. If we have to escalate this issue beyond Harare and beyond Zimbabwe, we are willing to do that if the courts fail to help us. But we believe they will be able to address that as well. This is why we have taken that route.
If I may add, it is actually very funny that if you look at the City of Harare Service Delivery Charter, it expressly states that it's governed by the Public Health Act, Chapter 15. And it states that it bestows public health agents on councils and elaborates the roles of councils as public health authorities. And health is an essential service. So why on earth would they even challenge or appeal for the case to be actually turned out? So we are simply saying that it's not fair, and it's not an issue that we must take for granted. It's a human rights issue. So they must simply open those clinics under whatever circumstance. They must put it as a priority.
My name is Lucy Yassi. I'm a freelance journalist. In your response to my colleague, you are saying you're going to challenge that appeal. How soon? And then number two, you're saying if the worst comes to the worst, you're going to escalate beyond Zimbabwe. Can you elaborate on that?
It's about seeking solidarity where we have the influence of the power of the people if we see that the courts are not helping us. So it's an advocacy and lobbying issue as well. Apart from the legal route that we are taking, if that does not work again, we will then seek solidarity from others who can also help in terms of trying to influence decision-making processes within the city. Because the Harare City Council also has partners who are outside Zimbabwe who are helping them, especially on the issue of water and also on issues of health delivery system. What does that mean when they are getting that assistance and they are not delivering those same services that they are seeking help for? So this is what we've been.
Yeah, my name is Yvonne Chak. I'm a freelance journalist. I just wanted to know if as residents have approached the Minister of Local Government or the Minister of Health to also get their perspective on this issue. What are they saying? Is there a solution in sight? Because the clinics may open, but if there are no drugs, if the healthcare personnel are not being paid, then we are going to be back again to the same situation where patients will die in the clinics without any help.
Yeah, so in our qualification, we also mentioned the Minister of Local Government, the Minister of Finance, as well as the Minister of Health as respondents. Also in that court application. But then when the order was given, the first respondent, which was the City of Harare, was given the primary mandate to do the opening of the clinics. But then in terms of the other ministries, this is something that we are already also doing, so that they also intervene. First, then the second thing in terms of the financial capacitation of the council clinics, apart from the budgets, that the city budgets that they do, and also some funds that they get from government, though they are not consistent and may not be enough. When citizens go to for health services at polyclinics, they are not getting those services for free. They pay. It's different from water, where you can get water and maybe you go for 6 months and you don't pay your bill. But with the health services, you actually have to pay, especially maternal health services. You pay. You cannot be admitted without paying your fee. There were cases at Harare Hospital where sometimes pregnant women who deliver there would be detained until they finish paying their bill. So the question also borders around issues of accountability in terms of how the revenue that is being collected currently is being used to ensure that at least the basic primary health services are accessed by residents. So it's really not just about to say Sito Ferrari is not capacitated, but it's about accountability on the finances that they have. Are those finances being used?
If I may add, this is why we are calling for the allocation of 15% budget, not on paper, but actual disbursements. Because if you look at our budgets, sometimes allocations are made on paper, but the actual disbursements may not happen. So we are saying Treasury should allocate an actual and disburse 15% of the annual budget to the Ministry of Health and Child Care so that they are able to support, because Ministry of Health is also supposed to disburse some of its funds to the city health departments countrywide. So it can only do that if it is capacitated through the budgets.
Do we have any more questions?